condoms, implants, Norwegian, IUDs, injectables, all those
uterine devices.
Yes.
Okay. And you want government to spend what?
20%. At least 20%.
20% of what?
Of its national resources, especially
budget.
when it comes to the health finance. You know, the budget is divided into various sectors. So when it comes to the health part, can we at least have 20% dedicated for FP?
Okay. How much is government spending now?
I don't have the accurate figure.
Is it up to 20%?
But it is not up to 20%.
Okay.
Yes.
So that's one commitment.
That is one of the commitments. And we do also have commitments towards ensuring that young people, irrespective of wherever you are, have enough information and education to be able to access FP. We have another.
How's that going? How are you getting the young people to know about these things?
So mostly we work through a lot of youth groups and youth networks, because in Ghana we do have a lot of civil society organizations that have youth groups and youth networks across the country. So what we do is a lot of youth consultations and information. We ask them, what do you want to see as a young person when it comes to family planning? Because we do not want to take decisions that at the end of the day the young people cannot own it.
Okay.
So Annette mentioned that at the end of the day, we want young people to be part of the discussion, and you can't take decisions without them.
Okay.
So that is why the youth focal point is there.
All right, so
to be able to do the consultations, get appropriate feedback, and then we bring it and say that this is what the young people want.
Okay.
Can we strategize and help them?
Okay, so you've talked about the financing, you've talked about talking to the young people. There are 3 more commitments.
Yes, and there's another commitment to that is to reduce the prevalence rates when it comes to married women who are not able to access family planning.
Okay.
So, at the end of the day, we assume that if you are married, why do you want to do family planning? Because people think family planning is just about saying you won't give birth. And if you are married, you're expected to give birth. And so we want to create the platform where married women or married people, a couple can decide that at the end of the day, though we are married, we should be able to say that we want 2 kids, we want 3 kids, or let's space our children such that there's 3 years in between them. So that is also part of the commitment. And another commitment is also to ensure that generally the population, everybody is informed, everybody understands, especially when it comes to our society. So a lot of society integration and demystifying myths and misconceptions about family planning. And the last one is on when it comes to adolescents, when it comes to adolescents and young people.
That also just dropped into your head.
also, we want to increase the rate for unmet need when it comes to family planning.
What is an unmet need?
Unmet need is, I'm a young person and I need family planning, but I do not have access to it. Maybe due to stigma or discrimination. Maybe I know PPHE gives family planning methods, but the service, just for instance, maybe the service provider there is not too friendly, because my friend came to tell me that, I went there and the service provider is not friendly. So I do not want to go. I also will not want to go there. So that is unmet need.
Okay.
I have a need, but it's not being met.
All right.
And so we want to make sure that the unmet needs of young people, when it comes to family planning, we are able to cater for that. It is also part of the family planning of the FP 2030.
So this is what Ghana has signed up for?
Yes.
All right. Antoinette, what are the challenges in getting to what you want? I mean, you want to amplify voices, you want to empower choices. What are your challenges with respect to amplifying voices?
Okay, so basically most of our challenges has to do with the myths and misconceptions. A lot of people feel that when you are on a family planning method and then you have a complication, then that means that it will affect the other person. What we fail to forget is that we are unique. Every woman is unique. And so we are all different. We are all not the same. And so a particular product might work for you, it might not work for the other person. And so you don't say that my friend is on an injectable and so I also want an injectable. No, it doesn't work like that. You also have to go in know all the options that are available, all the products that are available. When you get to the service provider, she would like to know, what do you know about family planning? Where did you even hear of it? Because we know that a lot of people have heard about all the family planning method. You should have a bit of knowledge about it so that the service provider will be able to help you on a particular one for you to be on. Now, if you are on that method and it happens that you feel uncomfortable with the method, there is that option for you to come back to the facility and change. Now, we even have commodities that are also self-care related, which means you can be in the comfort of your home and you administer it.
Like what?
Like the Sahana press, like the condoms, like the pills. It can actually be delivered to you in the comfort of your homes because it's self-administered. Yes. With the Sahana...
Well, the Okada brings the condom to me?
Yes, it can be delivered, just like
Really?
how we deliver pizza and everything.
Condom delivery.
Anywhere you are.
Anywhere you are, it can be delivered, and then they will give you a leaflet that will tell you how you are supposed to wear the condom appropriately.
People don't know how to wear condoms?
Yes, a lot of people don't know how to wear.
What are some of the wrong ways to be wearing a condom?
So someone can wear a condom without leaving a space between the penis and the condom, but rather push it down. And then that is where the condom will burst or break. And then we will say that the condom is no good. Meanwhile, the condom is very good. They use the polythene products for the condoms. Yes, we have varieties. We have flavors that have been put on many condoms based on the brand. But all condoms are polythene. And so they are good and can fit all sizes. Okay, but here is the case. We don't put it on well. It breaks or it bursts. Then you say that the commodity is not good. Meanwhile, the commodity is good. And so that is the need why we at PPAG, if we want to deliver condoms to you, we would add the steps. Yes. Okay.
And so when the person delivers, we would give a little demo there.
So we have a contact line attached to it, which is the Yenkasa contact line that you can call in case you are confused as to how to wear it. You can call, even though the leaflet is there. We know that still there are people who cannot even read, and then there are pictures to it. But still, you can just call the Yenkasa Contact Center. Okay. There are contact agents there 24/7 who are willing. Yes.
2:44 in the morning. If you need a condom, you call them. They'll bring it.
You call them, and then it will be delivered to your doorstep.
Wow.
Yes, and then they can even they can even help you as to how to wear it. Yes, so they will be on the phone with you and take you through the steps, the correct way of wearing a condom.
Yes, and then just to add up, as to some wrong ways, some people do not even check the expiry date on the condom. Condoms do have expiry dates, and some people just put it in their mouth and like try to tear it with their teeth, and you can actually bite into the condom because it is polythene, and create a hole.
So you have to use your
and make sure that you are checking the expiry date. It's not because if it's expired, then it means that it's really not going to work as you're expecting it to.
Okay. Yeah. So check the expiry date of the condoms, guys. Yeah, they expire too. Yeah. Like corned beef. Yeah. They expire. Yeah. Okay. So that's the amplifying voices side, and then empowering choices. So how are you doing that? What are the challenges to empowering choices of people?
Great. So so when it comes to empowering choices, that is where we give you the various options that are available. Okay. Because we do not want you to say that so you come to the facility and we say, oh, it is only implants. Okay. And then we give just the education on implants, and then you do not even know that.
So it's holistic. There was a picture of all the options of contraceptives. Let's bring that up, and then we can just go through them. So these are the choices that people have.
Yes.
Okay. Can you see?
Yes. Okay. I can see.
So go through them.
Okay. So the first one is the condom. Yeah, that's the male condom. So we have two types of condoms. We have the female condom and then the male condom. Okay. Basically, the male condom is supposed to protect you from unintended pregnancies and also from STIs. So the condom is the only form of contraceptive that also protects you from STIs. Okay. So aside,
sexually transmitted infections.
Yes, and diseases. It means that you could use a condom in addition to any other contraceptive method. Okay. It is not advised that you use two contraceptive methods at the same time. So, for example, you use the pill and the injectable. Okay. Because at the end of the day, they are both, serving the same purpose.
But you use the pill and condom?
Yes, because the condom is preventing you from sexually transmitted infections.
Some people use two condoms?
No. So if your partner is on a male condom, there's no need for the female to be on the female condom.
Okay, but can a man wear 2 condoms?
No.
Okay.
1 condom at a time.
1 condom, one man, 1 condom.
Yes, and then we do have the pills. We have the diaphragm. We have the intrauterine devices.
Okay.
We have the.
So the pill is swallowed.
Yes, yes,
Combined
yes,
oral
yes.
contraceptive pill that's swallowed. What's a vaginal ring?
So yes, the vaginal ring is also a contraceptive method, but it's unfortunate we don't have the vaginal ring and the diaphragm in Ghana.
We don't have them in Ghana?
No, we don't have them in Ghana.
Where will they land?
But in other countries, they have
Why don't we have vaginal rings and diaphragms in Ghana?
It's because of how complicated it is, one, and how it is being used, because it is placed in the vagina, and it's also very effective. But we don't
before
have
sex, or it's placed there?
So it is before sex.
Okay.
And then most of the time, they give it to sex workers. Let me say that most sex workers, most sex workers use the vaginal ring. Yes, please. But in Ghana, it is not here yet. The diaphragm was here some time ago. That is when we started with the family planning commodities, but it was out of the system.
All right.
Yeah.
So we have contraceptive injection that's available.
Yes.
How does that work?
So we have the injections. We have the 1 month injectables and then the 3 months injectables, where you come to the facility and then it will be injected.
Where?
So they can inject you on the arm or on the buttocks, and then it's the injectables. The Sahana press is also part of the injectables. The one that I said you can be in the comfort of your homes and it will be administered. With that one, when you come to the facility the first time, it will be demonstrated on how it is used. And so that one goes for 3 months, and then they'll show you how to calculate it so that the next 3 months they would.
Okay, so after 3 months, then you have to go and take another injection.
You have to go and take another injection. So they would actually teach you at the facility using a dummy method, and then when they feel that, they would ask you to do it on yourself, which you can do on the lower part of your abdomen.
You inject yourself?
Yes, by pressing it, and then it should be 2 fingers away, 2 inches away from your navel. And then you can inject your abdomen or you inject your thigh.
What does it do? What is it? Does something to the eggs?
It works perfectly like all family planning methods.
What does it do? It stops the eggs from coming?
It doesn't stop the eggs from coming, but what it does is that it prevents the eggs from meeting the sperm to make you pregnant.
Right.
So
there were a couple of other options there. Can we have that screen back again?
And then we also have the intrauterine device, which we have the 2 types. We have the copper T and then the hormonal intrauterine device.
What is it made of?
So it's one is made of copper, copper rings and plastic.
You're going to be putting copper in your vagina?
So it's actually done.
It's not in the vagina.
Where is it going? Where's the copper going?
They put it in the uterus.
The uterus?
It is placed in the uterus by a
uterus
service provider. Yes, please.
So how is it placed
blocks the tubes.
How is it placed in?
So it's done through a surgical method. Let me say the woman will go to the clinic and then the midwife would administer it. So by lying down, and then they'll get access to the womb or the uterus.
Will she be conscious, or she'll be asleep?
No, she would have her eyes. So it is nothing that is let me say has to take any anesthesia. No, and it's within 5-10 minutes they are done. It doesn't take a long process.
And what is the period? How long does it last there for?
So this one can last for 15 years.
15 years of copper inside the uterus?
But you can remove it as and when you are ready to give birth.
What are the risks of having copper inside my uterus? I don't have a uterus.
There is actually no risk to it. Even if you are someone who doesn't like copper or you are allergic to it, it doesn't have any effect on your uterus. It's just there because it's not only copper, it also has some plastic attached to it. And so you are fine, you are good to
15 years?
Yes, but it doesn't mean that you wait till the 15 years. You can decide to take it off after 2 years. You can decide to take it off after 1 year. And then you'll be fine. You turn back to fertility. It also even helps in correcting fertility issues.
Is it 100%? I mean, if the woman has a baby where the copper is inside, can she sue PPAG?
It is not possible that the copper will be inside. Definitely, as soon as you are pregnant, before you even get pregnant, you need to take it out. And so when you take it out, then you become pregnant. Yes.
But if it's there, you can't get pregnant.
If it's there, the protocol is that if it's there, it's supposed to prevent pregnancy. But yes, we have some people who would get pregnant and then will not test or will not show anything, and then probably to be placed. That one is 1 in a million.
Maybe the sperm had to be the egg, so it went against all the
or
barriers.
probably the person was even pregnant before
they put the ring on.
Yes, they put the place.
And then there's also the IUD with the silicone one.
Yeah, let's have the pictures back, please.
They are all just not copper. There's one with a silicone, and so you can opt for that one as well.
Okay.
That's the hormonal one. Which
also because I saw that you were scared about the copper. So there's one with a silicone as well.
There's one which looks like a T-junction. What is that? The one on the bottom?
Yes, that's
the intrauterine device.
That's what we are talking about.
That's what we are talking about.
Okay.
The copper T and then the one with the hormones. The one that has the hormones.
And the one on the bottom looking like an eye. What is that?
That's the implant.
Implant.
Yes.
Where are we implanting that?
Placed in the arm. So we have the 3 years and we also have the 5 years that is placed on your left arm. We put it on the left arm because we believe that you don't usually use your left hand
unless you're a lefty.
So if you're a lefty, it will be placed on your right. So they put it at where you don't vigorously use the hand regularly, so that it can be able to work. And so as it is placed there, it just goes through the system one after the other.
It's drip feeding it.
And then yes, that is the rod over there.
Okay, what is that purple one on
that's
the
top?
That's
the diaphragm that we don't have in Ghana. The diaphragm, yes, that is the one that we don't have. So
the one on the right, the pink one, the cream one is a condom.
Yes,
yes,
condom.
condom.
Yes,
everything
and then
else
we have the pill. Yes, everything else we have, and then we also have the emergency contraceptives pill, which is for emergency purposes.
Okay.
But yes, of course, people are
emergency,
using
what do you mean? Somebody has sex and they
So in case you have sex and you use the condom and the condom breaks, you are supposed to go in for the emergency condom. But right now, young people rather tend to use the emergency condom as
emergency contraceptive.
As a regular pill, which is not supposed to be so. Most people buy the emergency contraceptive pill, put it in their bags right after sex, and they take it. But that is not.
Doesn't work like that.
Yes, you are supposed to take it after 72 hours of having sex.
Or you wait for 72 hours.
So you take within the 72 hours of sex. But there is a condition to the emergency contraceptive pill. And that condition is in case the condom breaks or you are raped. But here is the case. We use it anyhow. As young people, that is it. And then it also has its own effect because it is made up of the combined pill. Let's take it that the pills that we take daily for 3 months, that is what has been combined for the emergency contraceptive pill. And you are taking that all the time.
It's the pharmacists who are selling these things to the people.
Yes, the pharmacists are selling it to them.
PPAG.
So we've been having discussions around this with the pharmacists and even with the young people themselves. And even some of them would come to you and tell you that I have been on this emergency contraceptive pill and it has failed me.
So now
it has made me pregnant. And so
the sex made her pregnant, not the pill.
Because she feels that she being on the pill would have saved her from not getting pregnant. But because she has abused it, she has become pregnant.
And then there's a reason why it is called emergency. If you want a daily pill, there's an daily oral pill that you can go for, which is a contraceptive method. Emergency contraception is not a contraceptive method.
Alrighty. How can we get in touch with you?
So you can get in touch by calling our contact center, which is the Yenkasa contact center. It's 0800 20 20 10, and as I said, it is 24/7. As soon as you call, there will be someone to talk to you and help you with your needs. Not only family planning, any issue on sexual and reproductive health.
Alrighty, that's Antoinette Darocha, program coordinator of the PPAG. Patience, last word, how can people get in touch?
Yeah, so through the same number,
0800 20 20
10. Anytime you can call us morning, afternoon, evening. Even if we miss your call, you definitely get a call back.
Wonderful. Patience Ampoma is FP 2030 Youth Focal Point for Ghana, and she's been here with Antoinette Darocha. We've been looking at family planning, amplifying voices, empowering choices. Now you know what the choices are. Let's plan the families. My name is Kafui Day, and I'm happy to be part of the GTV Breakfast family. We planned it nicely, and Valerie is coming up next with the social media corner. Do not go anywhere.